Question 11. Mrs. Featherhat is a Native American who has been diagnosed as near death. Her family wishes to perform a ceremony with candles and incense. The facility should A. Allow the ceremony with proper safety measures. B. Inform the family that the ceremony will not help her terminal condition. C. Transfer Mrs. Featherhat to a private facility for Native Americans. D. Not allow the ceremony because of safety precautions. Answer A. Explanation. Every culture and religion celebrates the end of life in a different way. As a healthcare professional, the nurse aide should support the resident and family in a positive and safe manner. Question 12. Mr. Smith, a 72-year-old male Alzheimer's patient, has been stopped several times today while wandering from unit. He is ambulatory but confused and combative. The CNA would first A. Call the physician for a restraint order, B. Redirect the resident or provide alternative activity, C. Immediately notify the charge nurse, D. Place the resident in a wheelchair with a soft waist restraint. Answer B. Explanation. Always assess the resident's mental status before asking about restraints. The resident may feel restless, but still be able to be redirected to another activity. Restraint orders are only used when residents are a threat to themselves or others. Question 13. As you finish your shift, a patient with a history of bowel incontinence has a strong odor. Your responsibility is to A. Help the oncoming nurse aide change the patient. B. Ignore the situation because your shift is over. C. Shout to the oncoming shift that they have a coat brown. D. Make sure the patient's room has plenty of supplies. Answer A. Explanation. Residents have a right to physical care and comfort, regardless of the time. As long as the nurse aide is on duty, they're responsible for providing excellent care. As a team member, the nurse aide should cooperate with other shifts to keep the residents' care a priority. Question 14. A nursing assistant closes the door, pulls curtains between beds, and covers the resident with a bath sheet when giving a bath. This is an example of maintaining a resident's A. Choice, B. Confidentiality, C. Privacy, D. Protection. Answer C. Explanation. Physical privacy is the right to do or say something without having someone witness. Examples are bathing a resident without exposing parts of the body not being washed, and closing the curtains between beds when giving care. Even reading a resident's greeting cards without permission can be considered a violation of their physical privacy. Question 15. In giving care according to the 1987 Nursing Home Reform Law, the nurse aide should A. Allow others to borrow the client's possessions, B. Open the client's mail without permission, C. Provide privacy during the client's personal care, D. Prevent the client from complaining about care. Answer C. Explanation. Residents have rights which include privacy, property, and the grievance process. When a resident enters a facility, it becomes their home and they have many of the same rights that they would have had in their private residences. Question 16. All the following situations are examples of abuse or neglect except A. Restraining a client according to a physician's order, B. Leaving a client alone in a bathtub to get a towel, C. Threatening to withhold a client's meals, D. Leaving client in a wet and soiled bed. Answer A. Explanation. Neglect is failure to provide appropriate care of a client. Leaving a client in an unsafe situation or in need of physical care are two examples. Verbal abuse, or so-called bullying, is a form of emotional abuse that can be as harmful as physical abuse. It includes yelling, criticism, blaming, insulting, belittling, or threatening. Restraints may only be applied with a physician's order. Question 17. Which of the following is the right of residents in a nursing facility? A. Making as much noise as they want. B. Taking a sleeping pill at night. C. Refusing treatment ordered by the doctor. D. Smoking in their room. Answer C. Explanation. Residents have the right to be informed about their medical status, to choose their doctor, and make decisions about their care. They may refuse treatment and medication. These rights have been in place since 1987 when the nursing home reform law was put into place. Question 13. A client wakes up during the night and asks for something to eat. The nurse should A. Tell the client that eating is not allowed during the night. B. Explain that breakfast is coming in 3 hours. C. Check client's diet before offering nourishment. D. Tell the client nothing is available at night. Answer C. Explanation. According to Medicare, residents have the right to make decisions regarding their schedule, including when to eat meals. Remember that for residents, the facility is their home now. They are able to choose their own schedule and activities. The nurse aide should check the diet orders, then bring a snack to the resident. Question 19. When getting ready to dress a client, the nurse aide should A. See if the clothes the client wore the day before are still clean. B. Choose clothes that the nurse aide personally likes. C. Give the client a choice of which outfit to wear. D. Get the first clothes the nurse aide can reach in the closet. Answer C. Explanation. By giving clients choices throughout the day, you are encouraging them to be independent. They have the right to be treated with dignity and respect, which includes being involved in making decisions about clothing, schedule, and activities. Question 20. A patient rings for the bedpan while visitors are in the room. The nurse should A. Give the bedpan to the patient in front of visitors. B. Ask the visitors to step out of the room. C. Wait until the visitors leave to help the patient. D. Tell the visitors they must leave in 15 minutes. Answer B. Explanation. Physical privacy is the right to do something without having someone witness. This includes personal functions such as toileting or grooming. The nurse aide can be an advocate for patients to help them meet their needs. If a patient needs to use the bedpan, the nurse aide should ask visitors to leave the room so the patient can use the bedpan and get cleaned up. The nurse aide can inform the visitors when they can return.
Thank you for watching.